Well, I want to welcome everyone to Penn Plastic Surgery's 7th annual Bra Day. The first five, for those of you who have been here with us, the first five we did in person. And for reasons that are obvious to everyone last year, and unfortunately this year again, we're doing this virtually. It is our sincerest hope that next year, 2022, our 8th annual Bra Day, we will be back all together in person. We are going to do this most likely at an off-site location, which will make parking and getting together easier for everyone rather than have it here at Penn. So this is actually the 10th annual National Bra Day. So what exactly is Bra Day? It's Breast Reconstruction Awareness Day. It was something that was initiated by our major national society in plastic surgery. It's called the American Society of Plastic Surgeons. And it was done to really help the public recognize the importance that breast reconstruction plays in the total care of many breast cancer patients. And it's really was aimed at kind of closing the loop for breast cancer treatment for many, many patients. And so while Bra Day is about making the public continue to recognize the importance of breast reconstruction, what we do, and you can see from these pictures from prior in-person Bra Days, it's about celebrating and recognizing and supporting all of you, our patients and our breast cancer survivors. It's just a wonderful time to get together and enjoy each other's company in a very, very positive venue. Again, we're not meeting in person, but despite that, the 2021 Bra Day planning committee and team has done an incredible job and a wonderful virtual event. I want to send my sincerest thanks to the Bra Day team here for this year's meeting. Amy Kliga, this is something she's absolutely passionate about. She has always been the driving force about Bra Day, and I say this every year when I get up and I make my introductory remarks, and I thank Amy for her incredible work on this. And I say that, believe it or not, tomorrow morning, Amy's going to start working on the 2022 Bra Day. I know it. I want to also thank Dave Akawa from Penn Plastic Surgery, our business administrator. And we have two new wonderful friends, Sue Weldon and Nina Ritrovato from Unite for Her, that have really put on a very special program. Again, make this virtual event very, very special. And you guys, I can't thank you enough for putting the bulk of this thing together. So the program for today is the following. We're going to start with an update on Penbra Educational Portal. This is something that we sort of shared with you initially last year. This has been the special project of one of our incredible plastic surgery residents, Tomi Famalusi, who's now a chief resident. And she really designed this project so as to better educate a patient on options for breast reconstruction, particularly at the time that they're diagnosed with breast cancer. And then the Unite for Her program involves the following: nutrition and mocktail, fall beauty, and there'll be an expert panel. And you can see from the Unite for Her, it's going to be Sue Weldon, followed by Erin Pellegrin, and then Jolene Hart. And then our expert panel will be Josh Fosno, who's one of my partners here at Penn Plastic Surgery, Tom Burgoon, who is an internist and acupuncturist, and then Michelle Stortz, who is a yoga therapist. Again, you guys from Unite for Her, thank you so much for putting this incredible program together. And we'll begin with Tomi, who's going to give us an update on the Penbra Educational Portal. So with that, I'll stop sharing. And Tomi, I'll give it to you.
Thank you so much, Dr. Cerletti. Good evening, everyone. I'm just going to take a second just to share my screen with you guys, and you can just let me know when you're able to see it. All right. Is everyone able to see that?
That looks good.
Great. All right. So as Dr. Sherletti said, this has been sort of a passion project for the past 2 years now. And the idea of this came out of understanding that breast reconstruction is a very complex process and involves a lot of decision making that can oftentimes be overwhelming for patients, especially at the time immediately after they have a diagnosis of breast cancer. So what I was looking to do and the Penbra team was looking to do was create something that could help educate our patients and empower them at the point that they're diagnosed with cancer, so that they can see sort of the finish line in all of this and see that in real time. So what exactly is Penbra? Penbra is the Penn Breast Reconstruction Advocate. It's a personalized education portal that is patient guided and paced. It allows patients to go through all of this information that we provide to them prior to their consultation with their plastic surgeon. This obviously gives patients the time to go through this information in an easily digestible way, and also at their leisure before they are actually in consultation with their plastic surgeon. So our mission is essentially to help our patients understand their options for reconstruction, to empower them to confidently discuss their preferences with their surgeon, and to support them throughout their reconstruction process and their recovery. And the portal, so patients will have access to this portal throughout their reconstruction process. So starting from the time of diagnosis, we are working on getting patients access to this as soon as they've seen their breast surgeon. And then they have this all the way through to after surgery and through the recovery process. We can you can get to this portal either on the web or through mobile access. It involves some illustrations, before and after pictures. There's some really cool features that we are trying to, we've incorporated into the portal. And I actually just have a short tour. I think it's easier for you guys to see exactly what it entails rather than me describe it. So I'm just gonna go through this quick, it's a very short video that just goes through exactly what the portal would be like for each patient. And then just let me know if you can see it moving. So again, for each patient, they would make their own personal account. When they go on the website, this is sort of what they see. They can go, there are several different topics. You can learn about what your mastectomy options would be, what your scars would look like, their photos, their great illustrations that were done by one of our other plastic surgery residents. They're photos of real patients who operations that were done by our plastic surgeons here. There's a cool note-taking feature that you can see on the right side of the page, where each patient, as they go through the portal, they can actually type down notes that pertain, notes or questions that pertain to themselves. And that can be done on every single page. You can go through your options for reconstruction, and in very simple terms, it explains what implant-based reconstruction is like, what tissue expander reconstruction is like. There's a video of a patient actually getting an expander fill. That was something that we realized can be oftentimes very anxiety provoking for patients. So you can actually see what this is like beforehand. We also have illustrations that show you what the different types of free flap reconstruction are like. So really just trying to show you what your options are before you even get into your consultation. So by the time you're sitting in front of your plastic surgeon, you can have a more nuanced discussion as to what you are interested in. And we also know that there are a lot of terms that might be new to some of our patients. We've included a glossary. So any word that is underlined, if you scroll over that, you get a quick definition of what that means. We never want our patients to feel that we're talking over them, and we want them to understand every single thing that we're saying. So this is a great way for patients to sort of get all of the information they need and come to their consultation very prepared. We also have, it covers a ton of things, including what the timeline for reconstruction will be like. So for different patients, depending on their lifestyle, timing of recovery is really important. So this is another way for you to get an idea of what your recovery will be like. It discussed what to expect after surgery in the hospital and when you go home, showing you what your drains could potentially look like. So we just wanted to create something really comprehensive for our patients, a resource that they can go back to at any point, even after the consultation, after surgery. You can always look at this information because this is your personal portal. Again, I mentioned that there's this add note feature. So at the end of all of that, you can actually see all of the notes that you've taken, and right at the top of the screen, you can print out all of your notes and actually bring that to your consultation with your surgeon. So really trying to empower our patients to be able to advocate for themselves when in a time that I think some patients feel like a lot of things are out of their control. Thank you so much. I hope you all have some time to go on the website, share it with your friends and family members. The website is penbra.org, very easy to remember, and we'll type it out into the chat as well. Feel free to make a profile for yourself and go through the information. Thank you.
Great, thank you, Tommy.
Yep.
As you can imagine, that is an incredible project that she took on. She did it with one of our medical students who's now an intern, and it's of enormous, enormous help for a patient newly diagnosed with breast cancer. So Tommy, thank you so much for doing this and for presenting today. So next, I have the pleasure of introducing Sue Weldon, who is the founder and CEO of Unite for Her. And the rest of the program, it was really designed by these guys in Unite for Her. Unite for Her is an incredible organization that helps support the well-being of patients diagnosed with both breast cancer and ovarian cancer. Sue, again, thank you so much for doing this year. And I think what you put together, for this virtual event is just fantastic. So I'll turn it over to you.
Thank you. We appreciate it. We love being here. And Dr. Famalusi, I love that portal. That's incredible. As a 17-year survivor and asking so many questions about reconstruction and going through the process, really, really incredible. My hat goes off to you. Thank you. So welcome, everyone. Welcome, everyone. So what a great event. And you should have received your care boxes by now. And we're hoping that you are loving them as much as we did, packing them for you. It is our honor to just place a little small part of our mission of health and wellness into your hands tonight. And tonight you're in for a treat. This hour is going to be all about you. And it's going to be about walking the walk of self-care. And just you showing up is such a huge win, making time for this, this type of emotional and physical healing. That's important that we do this every day. The lineup of speakers, they're remarkable. And the team in Penn Medicine and Plastic Surgery, they've all made this day possible, which we talked about earlier, and so grateful to have them as such a good supportive partner. They fully understand, how important it is to treat the whole person, emotionally and physically. For if you don't have both, we know that you're not fully healed. And truly, our partners at Penn are forward thinking. They understand the value of integrative care, and that has just made for a really incredible relationship over the years. For those of you that are not familiar with Unite for Her, I'll just give a quick background. We are a national nonprofit, I am proud to say. We're based right outside of Philadelphia, right in the Westchester area, and we bridge that gap, between the wellness community and the medical community by funding and delivering integrative care. Think about supportive care, right? To enrich the well-being and the health and wellness of those affected by breast and ovarian cancer. Think about therapies like medical acupuncture, whole food nutrition, cooking sessions, oncology massage, professional counseling, meditation, yoga, sexual health, CSA crop share delivered to your home, fitness membership, Reiki, and more. We have partnered with Penn for almost 9 years now and have served over 1,800 women and men with this very impactful wellness program. So if you are in our wellness program presently, let us know, put in the chat. We love to know how you used your passport. We love getting your feedback. It helps us get stronger as well. If you are new to our program and not presently in there, if you're diagnosed within 18 months, you do qualify, or living with metastatic disease, Amy will put that in the chat for us. And basically, it's very easy to apply. It is uniteforher.org/apply. And Nina Rigivato is our wellness program manager. She's on the call tonight as well. But, we want to be able to serve you. And that is, our mission, that we don't leave any patient or woman behind. If you're beyond 18 months of diagnosis, you can be invited to our alumni events, which is Thrive. And that alumni event, if you just go to info@uniteforher.org, and we'll put that in the chat as well. Just tell us that you want to get involved in those events. We have great speakers, almost similar to like the event that you're getting tonight. And we do those twice a year. So it just gives you a little bit of, a background. And we're going to watch the chat as we go along, and watching these questions. Nina, just shout them out if you feel like I need to answer. It's a very interactive event tonight. So, we want to make sure that either your questions are getting entered in real time, or we'll save them for the end. So know that we will get there for sure. All right. So we're ready to begin. And our first session is going to be an incredible cooking demo with our very own Erin Pellegrin. Erin has been with Unite for Her for close to 8-9 years now. And we are so grateful to have her. Her background is in also clinical oncology nutrition, which has just been an incredible balance, between understanding how to treat those that we serve, but also making nutrition fun, right? Like what you can do, and you may see her on our social channels. I say that she is our very own influencer at Unite for Her. We're happy to have her. And Erin, I am going to let you take it away with this fantastic mocktail tonight.
Oh, thank you so much. I'm so excited to be here. I appreciate being the person to sort of kick us off with a mocktail for what is promised to be a really engaging, interesting, educational evening. So I will dive right in. It's wonderful to see so many familiar names that I've seen come through as Nina has been letting everyone in. So it's so good to see everyone. For those of you that are not familiar with us, I just thought I would start by sharing a little bit of our nutrition mission and philosophy. As Sue said, we're really hands-on with our nutrition. It's been a pillar of our program from the get-go. COVID has certainly allowed us to pivot and learn new tools like digital cooking from our kitchen and mocktails, and we're just able to bring education and empowerment in the kitchen to our community, and that's what we're doing tonight. So our team, our nutrition team, does a lot of cooking education with cooking classes, sharing new recipes, really demonstrating the pillars of our mission, which are centered around helping our community eat more whole foods and eating more plant-based. Certainly when we say plant-based, I always say we don't necessarily mean everyone should be vegan or vegetarian, but we're putting those plant-based foods forward. We're making them center stage. We know without question, the data is there, the supportive benefits of all of the variety of plant-based foods that we have available to us. And so, we use our virtual kitchens to demonstrate, to offer new recipes, and that includes things like mocktails. So that's what we'll be doing tonight. One of the lessons I often give at our wellness days is that if you don't know where to start, get back in the kitchen and start working with ingredients again. That's the way that we know the quality of the food that is going into what we're making. And so again, that's what we're doing this evening, even with mocktails. So I will get us started. So we love seasonal recipes, and that is what we're making this evening. So we are doing a cider sangria. We're using some seasonal produce to cook us off. I've used really fresh ingredients along the way. And this is something really simple that you can make at home to impress even yourself, even your family members. If you're entertaining as we're getting into the holiday season, this is something that will sure impress all of your guests. So our cider sangria starts off with a pear syrup. So I like to talk a little bit about how you can make this, because this is something that we often see if we're going out, if you're having a cocktail or a mocktail, you might see infused syrups and it sounds fancy. It does not have to be. This is a wonderful way to infuse any sort of flavor into a cold beverage. So this is also something, if you're making your own tea and you're putting it over ice, this is an infused syrup is something that can dilute in a cold beverage. So what I've done for my syrup here, and don't worry, I'm not using all of this. This will last me probably through the end of the year. So how I made this, you use a little bit of honey and water, so equal parts. And then I infused this with some pear, rosemary, lemon rinds, lemon juice, and some freshly grated nutmeg. I brought this to a simmer on my stovetop, and then I let it rest. I strained it, and that is how you make a simple syrup. And so you can do this with any sort of infusion of flavors. Think your savory herbs, think other fruits of the season, all of your spices. So this is just something that can allow you to kind of step up your game with your mocktails at home, or even if you just want something really delicious to make you feel special at home. We love that. So that will be part of our mocktail this evening. So I will start by prepping some of our fresh ingredients. So as I mentioned, we're using some fresh fruit. So I'm cutting up some apples and some pears. And this falls in line with what you may think of as a regular sangria. So if this were in the summer, we would be using produce that's more in season to the summer, but we're in the fall. It definitely feels like fall in the Philadelphia area. In fact, I've seen some of my neighbors from Center City, Philadelphia here this evening, so I'm so happy to see you. So we will be using some fresh fruit. So I'm just cutting up. If you don't have pears or apples at home, use whatever seasonal fruit you have. You can use any variety of pear, of apple. You just want to make sure that they're in season so they impart beautiful flavor. Okay, so from here, we'll just start mixing. This is super easy and it's really, really delicious. So we do need a mixer. So anything that you have at home, we're throwing everything into our mixer. The first thing we're starting with are 3 ounces of fresh apple cider. So again, we talk about the quality of the ingredients. And so if you can get a local, a really high quality apple cider, it imparts not only delicious flavors, but that little hint of sweetness as well. So we've got 3 ounces of apple cider. I have 4 ounces of freshly squeezed lime juice. So we want to sort of build balance between a little bit of tartness and bite and a little bit of sweetness. If you don't have lime, feel free to use a little bit of lemon as well, totally fine. But again, it creates a little bit of balance here. Next, going in our mixer, we've got 1 ounce of pear syrup. So remember that syrup I talked about. This will last me in the refrigerator well into 2022. So take note of that. All right, 1 ounce goes in, again, creating balance with our sweet and savory. From here, I've got some good orange bitters. So also stepping up our game with mocktails. So I'll do a couple splashes of that. And then, as with any sangria, we're using our fresh produce here. So I'll throw all of this in because why not? I love anytime I can use some fresh fruit of the season, and my apple and my pear were really, really ripe. So they're going to be delicious. From here, we'll close this tight. Give this a nice little shake just to make sure everything is really well mixed, not too much. We're not straining. So again, we're sort of keeping in line with that sangria, which I love. Now you can put this in any kind of glass. So I cheated a little earlier and I did make one myself, just to test it out. So you could use any kind of glass that you want. We use recipes for mocktails often because we talk about the experience of food and even using things like mocktails to make yourself feel special. If you're having some time for yourself, we don't always need to include alcohol. We know the risks that come along with it, but creating something like this allows you to feel special, a little bit fancy, use that fancy glass. We love that. So all of this mix will go into my big wine glass here. I will add a little bit of ice to this. So you can use as much or as little as you want, but we do want this to stay chilled. So I'll add some cubes here. And then to top off our mocktail, got a little bit of tonic water. So just a splash, adds a little bit of bubbly, a little bit of carbonation, really finishes it nicely. And there we have it. Our cider sangria, taste of the season, absolutely delicious. I'll tell you what it tastes like just because I have to be the one to taste it. Delicious. Oh my gosh, it's delicious. You definitely, again, quality of ingredients, right? So I'm getting those hints of the season from the little bit of pear syrup and also from the apple cider, right? Like all that apple, all that earthiness. It's nicely sweetened with a little bit of the syrup, but I get a little bit of bite at the end. So this is certain to be a crowd pleaser at the holidays or something really special that you can whip up for yourself. It's single serving, that recipe. So maybe cozy in with a book on a cold evening, pour yourself something like this, totally enjoy the moment, but definitely cheers to that. Enjoy the rest of your evening. If we have a few minutes, I'm welcome to take any questions about our nutrition program or about nutrition in general, but I know we have Jolene coming up and she's going to share some of my favorite beauty information. You'll love listening to her.
Yeah, thank you, Erin. I just
You're
love
welcome.
you're doing these. I always wish I have what you have in front of me though.
I
And
wish I
it's
lived
always the
closer
case.
to you,
I
Sue.
know, totally. I'm going to let you do
Yeah.
one question that I saw.
Sure.
And I believe it was Angelina was asking if we know a good plant-based cookbook that's out there. And you know, one of my favorite is Ottolenghi. I love Ottolenghi. And I do feel like he is so plant-based, even though he has some
Yeah.
recipes that have, you know, chicken and lamb, Israeli. Do you know one that you can recommend offhand? If not, you can think about it and put it in the chat.
Oh my gosh. Well, so one of my favorite plant-based cookbooks is called Vegetable Kingdom, and I can actually go run and grab it, but I won't. Maybe we'll share it later. But Sue, I mentioned this to you before. So Vegetable Kingdom. The name of the chef slips me, but I actually saw a segment of his on CBS Sunday Morning one morning, and he just takes traditional Southern dishes and has created them to be vegan. He's entirely vegan, and his recipes are out of this world. They're just super flavorful. They're super nutrient dense. There's a twist on a lot of maybe your heavier Southern dishes, but no lacking of flavor. So I really love to check out some of his recipes in his cookbook.
Yeah, I remember that. Recommendation. Awesome.
Yeah, absolutely. But even the Cancer Fighting Kitchen cookbook that we offer in our program as well, there are so many really wonderful plant-based recipes in there, from burgers to soups to salads to grain salads. There's a lot of options there as well. So.
Yeah. And if you guys are familiar, if you're not, you would get them at our wellness retreat, the Cancer Fighting Kitchen cookbook. But that first 40 pages is just, you know, gold star on this first 40 pages, because it tells you all about the ingredients and how those ingredients are very disease fighting, preventative. It just gives you knowledge, right? And when food is powerful, when you have the knowledge behind it. All right.
Yeah,
thanks, Erin.
absolutely.
Mm-hmm.
Thank you. Enjoy the evening.
Perfect. Yeah, thanks. All right, we're going to move over and we are going to introduce Jolene Hart. And Jolene, you know, she is our Unite for Her Beauty advisor. She has been with us for, I want to say 8 to 9 years too. Jolene, I remember you writing your first book at that wellness day. It was so good. I still remember that. And she has been pioneering this beautiful integrative beauty since 2010 and educating women about the connection of diet and lifestyle and beauty for over a decade. So Jolene, I am so happy to have you here tonight, and I will let you take it away.
My pleasure to be here. Thank you for the beautiful intro. My screen, because I do have slides just to help you to follow along. I'm going to be sharing, let's see, there we go. I'm going to be sharing a little bit about fall beauty, lifestyle, and nutrition shifts that you can make this season. But first of all, you might ask how the topic of beauty fits into this event. And to put it simply, talking about beauty can remind us of the real importance of self-care. I've worked in the beauty industry for more than 15 years, and I find that sometimes self-care gets trivialized. We think about it as fuzzy slippers and bubble baths, but there are such real important physical and emotional benefits that you receive from caring for your body and your beauty. And that supports thriving, resilience. It supports your joy day to day. And I think that your beauty routine can be such a powerful tool for shifting your energy when you need it most, when you have a day or a moment or a week or a month when you really need that extra self-care. That healthy beauty routine can really show up for you. Now, whatever that routine entails, I think it's much more about how you show up for yourself rather than how you show up for the world. And it's so difficult to prioritize that when you've gone through any period of illness or any challenge in your life. So this is your excuse to kind of switch back over and put some priority into that beauty routine. When you're in survival mode, taking care of your appearance is one of the last things that you typically think about. But I've learned personally and through the women that I coach that the way you take care of yourself directly feeds into your personal resilience, your emotional resilience, and that makes physical changes in your body that support healing and thriving. So to me, beauty is also about cultivating a closer relationship with your body and strengthening that skill of inner listening. And if we listen closely this fall season, we might hear our bodies calling out for something a little different. Some warmer food, maybe some more grounding meals, extra hydration. And a lot of people think fall beauty is, choosing a darker lipstick color or a thicker moisturizer, and it certainly can be those things, but foremost, it's about keeping our bodies in balance by shifting nutrition and shifting habits with the season. It's about listening and responding to our needs, even when they might be subtle and they might get overshadowed by daily life. So let's look at what our needs really are this fall season. Common beauty concerns in the cool weather. So we start to feel a little bit more dryness. This might be the top complaint that I hear in the cool weather. Our cell turnover starts to slow. And basically that means that you might see a little bit of lackluster complexion. Your skin doesn't look quite as smooth and glowy. It's something natural that happens in the cooler weather. So a little bit of extra exfoliation can be a nice balance when the weather turns cool. You might find extra redness or sensitivity, extra inflammation, and this is often driven by the holidays. So extra sweets, maybe alcohol, maybe we're not having those mocktails, we're going for the real thing, and temperature extremes. So when it gets very cold out and then you've got a blast of hot air inside, that can be inflammation inducing in your complexion. You might see breakouts from the seasonal transition, and you might even see lingering damage from summer sun exposure. So your body's working on healing a lot of that this season. Now, these cooler, darker months represent the most yin time of the year. You've heard of that yin-yang balance. And yin is all about turning inward. It's about being quieter. It's about recharging and sort of having that darker period be very rejuvenating for your body. So these months allow us to deeply recharge and to nourish. And when you do that in the fall and winter, you really promote balance in your body and your beauty that extends to the spring and the summer. It's a year-long cycle, and when you get the fall and winter right, you find that you feel even better in the spring and summer months. So here's some intentions to set for your fall beauty. As a health coach, nutrition is really the foundation of how I support healthy skin. So we want to make some shifts in what we're doing and how we're eating this season. The first is to try skipping those cold breakfasts. Opt for anything that could be warming. It could be spiced up. It could be warm cereals. You could even go for a savory dish. You could have soup in the morning, even dinner leftovers. Anything that keeps you warm in the morning, that supports that your steady blood sugar that's going to keep you full until your next meal is going to be wonderful for your hormone balance and your skin. You also want to prioritize hydration. So when the weather gets cool and we're not sweating as much, we sometimes forget that we have that need and our thirst isn't really driving our hydration. So it's great to start the day with something like a warm lemon water, even before you reach for coffee, if you're a coffee drinker, or tea. And I always give my clients bonus points if they add fresh ginger, fresh turmeric, which are very anti-inflammatory and warming to the body. And I recommend drinking hot or warm water or herbal teas throughout the day. It's wonderful for supporting your hydration and your circulation. This season, it's also great to eat some bigger meals in the morning, and then remember to eat less in the evening. Even though it's darker, or maybe at dinner time, that will help to support better sleep, to not eat a big meal late at night. Also adding ample good fats, and that supports healthy skin cell membranes and skin moisture, which is going to help with that dryness complaint that we hear a lot this season. making more nourishing soups, broths, grains, beans, and of course, being conscious of sugar intake through the holidays. So remember to enjoy what you love, but know that sugar really does set off an inflammatory cascade that can visibly impact your skin. So what I say is, pick the sweets you truly want to eat and truly want to enjoy, and skip the others, and know that you are doing your skin and your body a favor when you moderate. And of course, just the intention of resting more. We're entering a season of recharging, and that can be really helpful for your body and your skin. Top foods for body and skin. A lot of these you're going to say, hey, I'm seeing these at the farmer's market right now. This is what we're getting. This is what we're harvesting at this time of year. Everything from apples, maybe you've been apple picking. They're fantastic. That pectin fiber supports natural detox, and it's great for combating allergy symptoms. Pumpkin, we've got packed with healing beta carotene that supports your skin cell production and sebum balance in your skin. We've even got, sweet potato, again, really high in beta carotene. A lot of those beta carotene foods, a lot of the grounding root vegetables this season, and those are so deeply nourishing for the body. You might not know garlic is a top immune booster, but also a wrinkle blocker. And cacao has the same benefit. It has some phytochemicals that help to stop the cascade that helps wrinkles to form in the body. So looking for raw cacao, dark chocolate. We love these for the holidays, but there are so many benefits for your skin, in addition to endorphins, helping with serotonin and bringing circulation to your skin, that has been shown in studies to reduce skin redness. So hopefully some of these foods get you excited about cooking for the fall, but know that you're also nourishing your beauty at the same time. Now, favorite cool weather rituals. We always talk about beauty upgrades at Unite for Her. How can we take what we're doing and give it a little bit of an upgrade? And one thing I love to recommend to my clients is getting a little bit of morning or early day sunlight. Just 10 minutes in the morning is so key for hormone balance, for melatonin production. That's going to help you to sleep more deeply in the evening, and that circadian rhythm. So start a ritual where maybe you have that warm lemon water by your window in the morning, get a little extra sunlight. I'd love to recommend dry brushing your skin, which helps with your lymph flow, which can stagnate if we sit a lot, or we're even in the cooler months, we tend to kind of stagnate a little bit. So dry brushing, and then adding your favorite body oil. Maybe you have access to an infrared sauna or to steam. Any way that you can help to support circulation and sweating this season, you're going to be distributing those oils on your scalp and your skin, and that is really supportive of healthy hair and healthy skin. We often forget that skin that looks dewy and reads as being more dewy and moist also looks to us as more youthful. So whatever decade you may be in, focusing on that healthy skin moisture and making sure that you are sweating is something that can be really powerful for your skin. Also warming up. I love to create a bedtime ritual and begin that 30 minutes before bed so that I have kind of a time to wind down into sleep and really prioritize that for my beauty. And we also think of fall as being the season of letting go. And as a little reminder, it's a great time to clean out our beauty routine if there's anything that you want to kind of let go of and even upgrade. So where do you start? You don't have to throw everything out. I always recommend, what are the top products that you use the most often? Maybe every day you're using deodorant, a particular bar soap, maybe it's a shampoo or a body lotion. Try to upgrade those products and make sure those are going to be the best quality for your body. And it's a great place to start. You'll make a big influence over your beauty routine. And just for fun, Erin gave us that amazing recipe. I wanted to share, I have a great packet of holiday recipes too, along with a list of my favorite clean burning candles, because candles are such a favorite this time of year. If you hold your phone camera up to this little QR code, it will take you to the site with the holiday recipe download and my list of favorite candle companies. If you love to burn candles, these are going to be candles without synthetic fragrance. So a natural fragrance that are still going to smell amazing, but be a little bit more clean burning for your home and supportive of your beauty. So I hope this gets you excited about fall beauty, about maybe creating a new self-care ritual, and certainly taking care of yourself to support thriving and healing wherever you are on your journey.
Love that. Thank you, Jolene. Gosh, I love the QR code. We got to do that on our wellness days.
So good, right? It makes so much sense.
Pop that baby right up. Yeah.
There you go. It's that easy.
I know the candles are a big one. I think people forget about candles.
It
And
really affects your air quality, especially if you
Yeah.
have the synthetic fragrance, which Sue, you and I talked about recently, but a lot of those synthetic fragrances contain phthalates, which a new study just came out about a week ago, showing the impact on, the endocrine disruption impact on the body. So I always recommend, if you can, cut down on some of those synthetic fragrances and switch to a natural fragrance. Even a little bit of a shift really changes your exposure.
yeah, love it. Thanks, Jolene. All right, Jolene, are you going to hang out a little bit with us?
Yes, absolutely.
Awesome. Okay, so if there's any questions in the chat, please
be
feel
here.
free to ask Jolene right there in the chat. We're going to keep moving along so that we can stay on time, but she's a master at getting in there and answering anything that you need. All right, so the next part of our program tonight is our expert panel, and it's such a good lineup. So I am going to start. I'm going to allow them to introduce themselves as well. You heard a little bit from Dr. Serletti, and we're going to start with Dr. Fosno, and he is a Penn Medicine plastic and reconstruction surgeon. Probably all of you know him here. And Dr. Fosno, we're going to make sure everybody keeps you on speaker view, and you can give yourself a little introduction.
Thanks, Sue. So I hope everyone can hear me, and thank you all for being here. Over the years, we've had a great time with our broad day events, particularly in person, but it's so great to see how still great a job we can do, or you all can do, in organizing this in an online format. This year's theme of sort of a more multidisciplinary approach to health is one that is incredibly important to me. I see a lot of my own patients on the list of people here tonight, and for those of you who have sat in an office space with me, may have heard me say that the process of breast cancer diagnosis and care is really a journey, and everyone goes through that journey in their own way and at their own pace. But it is certainly true that while your cancer surgeon and/or oncologist and reconstructive surgeon are a large component of your care, there is so much more to that process that goes beyond standard medicine, that gets you from point A to point B. Whether that's the help of family and friends, physical therapists, yoga therapists, acupuncturists, nutritionists, or mental health care providers, there's so much more out there that really contributes to this process in your overall health. And so with that being said, I thank all of you for being here. I thank the organizers of this event. And I'm excited to sit on this panel with some people that hopefully will talk about things that I don't know anything about. So I'm going to learn some things here too.
That's great. Thank you. I know we learn every day. Every time I hear Jolene talk, I don't know how many times a month, and still I'm always picking up tips. So glad to have you. Thank you for that wonderful introduction. Dr. Tom Burgoon is going to be coming up next. He is actually our acupuncture advisor, has been with Unite for Her since the beginning. And when I tell you we have one of the finest in the nation right here locally, we have one of the finest in the nation, specializing in medical acupuncture and internists, and has sat on the American Academy of Acupuncture for, I think, that board for 8 years. Is that right, Dr. Burgoon?
For a while, yeah.
Yeah, it was a while. All right, I'll let you take it from here.
Thank you, Sue. And welcome to everyone. It's really a pleasure to be here and to share the panel with Dr. Fosnot and Michelle today. So I'm an internal medicine physician in Westchester, Pennsylvania, and I specialize in medical acupuncture and Chinese medicine. I've been practicing medicine now for 36 years, and for 26 of those years, I've been using acupuncture in my practice. As Sue mentioned, I was the past president of the American Academy of Medical Acupuncture. That's the largest organization of physicians using acupuncture in their practice here in the United States. And I am also on the board of directors of an international organization for physician acupuncture that represents about 50,000 physicians around the world in about 40 countries using acupuncture. And out of all those things I do, I have to say one of the roles I really love is being part of Unite for Her and being the advisor. And I'm happy to be here today and to talk to you about how acupuncture can be helpful for women going through breast cancer care. Turns out it can do a lot of things to complement what we're doing in regular medicine, and it can make the journey a lot easier. So we can talk about that.
Awesome. Thank you. Thank you, Dr. Burgoon. And our last panelist is Michelle Stortz, and she is our advisor as well. So you have a terrific team up here, a terrific panel. Been an advisor for us for over 4 years, I want to say now. The years are flying by, especially with COVID, and a yoga therapist that specializes, in that complementary care. So Michelle, I'll let you take it from here.
Yes, I'm honored to be here. And I think I've been with Unite for Her for 10 years now. So it's been quite a while.
Wow.
And I've been doing yoga therapy 11 years. So quite a while. I am a yoga therapist, which you might not have heard of a yoga therapist, but I am specializing in oncology care. And yoga really is what we've been talking about tonight, this self-care of the whole person. So when I say yoga, you might think about those pretzel poses with the foot behind the head, and that's really not at all what I mean, what we mean by yoga, using yoga for self-care. We really mean, how can you really embody, be in your body and care for your body as well as your heart, and quiet your mind. And I've really been passionate about offering tools and practices that help you deal with those difficult emotions, quiet the mind so that you can sleep better, deal with anxiety. I've created 6-week courses like Stronger After Cancer for folks who are done with active treatment. I have another course for those with metastatic cancer. Same sort of really focusing on the whole being, self-care with really practical, usable tools. And my most recent creation now is Preparing for Surgery, a workshop called Preparing for Surgery. And I'll be launching that in November, but that's ready to go. So thank you.
Wonderful. Thank you, Michelle. All right, Nina, if we can pull our panel up, we'll put all 3 of them up there in spotlight for the group. And I'm going to start, asking some questions. We got quite a bit from the participants that are here today when we did the survey and put it out when they registered. So Dr. Fosno, I'm going to start with you. I know a lot of people are concerned about lymphedema, and they talk about prevention. They talk about what to do when they have symptoms appear. Could you take that topic for us?
Sure. Lymphedema is unfortunately a side effect that some patients do experience from breast cancer treatment, with particular risk factors being lymph node dissection and radiation therapy. Not everyone gets it, but we think about lymphedema perhaps in a way of its most significant symptoms of gross arm swelling or leg swelling if it's in the lower extremity. But the reality is early lymphedema can present as something that you don't even see. It's something you feel, whether that's just a heaviness in your hand, a general sense of weakness, clumsiness, things that you may not think about as being lymphedema. Those can be early symptoms of a problem that may develop. And then as that progresses, it can progress to things such as arm or hand swelling, which may be temporary in nature. It may be something you only notice with certain activities that then goes away at rest. And then in its more extreme way, extreme extent of being sort of permanent arm swelling. It's really important to recognize when those symptoms are developing, because I'll tell you the first thing to not do is ignore it and hold your arm in a static position and not exercise or not stretch or things like that. Those are the wrong things. The right things are seeking attention early. And if that's a physical therapist who specializes in the treatment of lymphedema, I think that's a wonderful place to start. But there may be other modalities that may be helpful as well. But it's also a common misconception that physical activity is something you can't do when you have lymphedema. And that's been pretty well studied at this point, and something that we all recognize as being probably a misconception. And so being physically active, participating in physical therapy and or yoga or other modalities is important to try to help train your body how to handle that fluid mismanagement.
Great, thank you. That sort of sets you up nicely, Michelle, because you know, I know you get a lot of questions about lymphedema, especially from our community. So I'm going to put that over to you as well and let you have a little bit of time there on that topic.
Yes, what I like to educate my folks on is that the lymph system does not have its own pump the way the heart pumps blood. So the lymph system relies on movement. It's actually the muscles contracting and moving that helps all that lymph fluid flow. So you do want to keep moving. And of course, if you've been given some exercise by a lymphedema physical therapist, I encourage you to keep doing those. And I would bet that almost all of them have your arms, if we're talking about lymph nodes here in the upper body, they have your arms somewhere at shoulder height or above. So not only are you moving the arm you're using gravity, you're letting gravity help that lymph flow. So almost always there's some kind of movement with the arms above shoulder height so that you can let gravity help the lymph flow, and you're just moving the limbs in some way so that things are flowing. And of course, you are, being careful about your range of motion, right? So you're not doing anything that's not in your comfortable range of motion. Yeah.
Great. Thanks, Michelle.
Mhm.
Dr. Burgoon, I'm going to go over to you now. And I think just to set up our evening on the topic of acupuncture, can you just give an explanation of what acupuncture is so everybody's on the same page starting off?
Sure, Sue, thank you. So acupuncture is a system of medical therapy that's been used in China for more than 2,500 years for a wide spectrum of both human and animal illnesses. It utilizes small hair-thin needles to initiate physiologic responses of repair and regulation in the body. This is what we know about acupuncture. And now it has a history, as I mentioned, of being used for animals as well as humans. There are 2 schools of veterinary medicine in this country that have programs associated with them to teach veterinary doctors how to use it effectively for their animal patients. And the things that they do, I know the physicians in both of those programs, it's quite remarkable what they can do with animals. And so anyway, the reason I mention this is because it's important to understand that you don't need to believe in acupuncture for it to work. It's a physiologic stimulus. Yeah.
Yeah. Thank you, Dr. Burgoon. All right, Dr. Fosno, I'm going to go back to you. And what exercises can you do after reconstruction surgery? I heard you say physical movement is important for lymphedema. Are there any that people should stay away from after surgery? I know, like, people say, can I do push-ups, right?
Mhm.
Can I play sports with my implants? Can you take that one?
Yeah, so my general feeling about this, and obviously it does depend on what type of surgery you have, but it's a progressive return to activity. There's certainly that first 3 or 4, sometimes 6-week time period where I recommend, first off, just starting with range of motion exercises. So simple things, like Michelle mentioned, of working on shoulder range of motion to get you out of that phase of sort of doing, this, where you're bringing your head down to your arm rather than actually getting your arm up to a full state of range of motion. Working on things where you walk your arm up the wall. Just to stay limber is incredibly important in that short-term recovery period, because surgery and pain has a tendency to cause this sort of contracted state. Once your surgeon, has sort of seen you and is happy with how things are healing, and you don't have any weightlifting restrictions, then I generally recommend a steady return to function in the things that you like to do, starting with low resistance and working up to the resistance levels that you're, interested in getting to. What that means is don't go out and lift the heaviest object you can find as soon as your surgeon gives you the green light. Start slowly. See what works for a couple of days. If what you introduced goes well, then push yourself a little bit more a couple days after that. In terms of the long-term activity restrictions, I am a firm believer that you should not let your breast cancer and reconstruction drive your life long-term. That means to me that I tell my patients I have zero restrictions long-term on your activity. You can do push-ups. I have patients that do Spartan races after their implant reconstruction, running marathons. I don't think this should deter you in doing anything physical. And most of the time, in fact, almost all of the time, physical activity has very little, if no outcome, no adverse outcome on your reconstruction. If for some reason there is an implant movement or migration, we'll tackle that. But you shouldn't let that drive how you go through life. And there's no physical activity out there that you're going to do that's going to pop your implant. I've heard that question a lot, so don't worry about that one.
That was going to be one of my next ones. So I'm glad you got there. Thank you. Michelle, I'm going to give you a very similar question because I know lymphedema, just that movement of the arm, they can't move their arm in certain ways. And what can you do to help? Do you have a series of exercises that you feel like are so important for that movement and just after surgery, that post-surgery, what they can do?
It's similar to what Dr. Fosno was saying, just range of motion. Do I have a set series? No, I don't. But I will always be, gently checking out the range of motion. What does it feel like? And don't push through pain. Don't push through pain. If you're not there yet, you're not there. There's no need to rush your range of motion. Almost every class, I do some shoulder rolls. So this is, one of my favorites. And then these elbow circles, my standbys. I love those because really you're talking about this range of motion. And yes, do keep it moving as soon as you get the clearance from your surgeon, your doctor, so that scar tissue is not really setting in and hardening, getting just range of motion. Yeah.
Great. Thank you, Michelle.
Mm-hmm.
Dr. Burgoon, can you go through what kind of problems, is acupuncture helpful for women going under cancer care? There's a lot.
Thank you, Sue.
Mm-hmm.
So acupuncture has been being used now as part of comprehensive cancer care at many of the most prestigious academic cancer centers around the country now for going on 15 years or so. The kinds of problems for which acupuncture is commonly found to be helpful for in this setting, one is pain. This can be muscle and joint pains. They can be post-operative pain, or it can be muscle and joint aches, say from aromatase inhibitors. It can be muscle and joint pains that were pre-existing to the cancer care, but then become sort of exacerbated through the process. It can be metastatic cancer pain, bone pain. Another area where acupuncture is found to be helpful is in gastrointestinal problems. One of the first areas that was studied in modern science in this respect was the ability for acupuncture to help with chemotherapy-induced nausea and vomiting. But it turns out that acupuncture is helpful for a number of gastroenterologic problems. It can be nausea and vomiting, it can be indigestion, constipation, and diarrhea. And another area is in that of vasomotor symptoms, hot flashes and night sweats. We know that acupuncture is helpful for this. For instance, there was a study at Henry Ford Hospital by the Department of Radiation Therapy in which the researchers they researched the use of acupuncture for treating the hot flashes and night sweats from anti-estrogen therapy. And one group of patients got Effexor, venlafaxine, the most commonly used drug therapy for this problem. The other group got acupuncture. And they found that acupuncture resolved the hot flashes and night sweats as well as the Effexor, only there were some differences. The acupuncture, the patients who got the acupuncture, the benefit in terms of the hot flashes, night sweats, lasted much longer, up to a year, than the Effexor patients when the therapies were stopped in both groups. And Also, they noticed that with the acupuncture, they didn't get new side effects, whereas unfortunately in the effexor group, the patient's hot flushes, night sweats were improved, but they had some of the typical side effects with that therapy. Another area where acupuncture is helpful is insomnia, anxiety, and depression. Chinese medicine offers some valuable insights into how to help with these kinds of problems, and acupuncture is one modality that is helpful. Acupuncture can also be helpful for the neuropathy associated with chemotherapy induced from chemotherapy. And it's also beneficial in the recovery phase. After all the cancer therapy is done, acupuncture can be helpful in the recovery phase and return to normal health.
Thank you, Dr. Burgoon. I'm going to go over into the chat because I saw a question here, and it's for Dr. Fosno. Tamara said that she had a free flap surgery with small implants, and she was just wondering why the implants go on top instead of under the muscle. She never really thought to ask why.
Specific to her, I don't know that I can answer the question of any particular patient. I would say in general, implants can be put above or below the muscle. There are indications for doing it either way. When the soft tissue that is being used to hide that implant is thin, meaning if it's a very small flap or a very thin patient, sometimes going below the muscle is helpful to try to hide the implant a little bit better, which is the most common place to put it, for instance, after a breast augmentation. Sometimes if there's enough soft tissue to hide the implant well, putting it above the muscle can minimize pain, minimize discomfort, and or just make the recovery a little bit easier. I hope that answers the question.
Yeah, that's good. Okay, thank you. I'm actually going to stay with you. How often do you need to get your implants replaced? That's another question that I know a lot of us think about often.
Generally quote people a 50% failure rate by 15 years. So that doesn't mean that everyone needs to be replaced. Every implant needs to be replaced at 15 years. I've had patients come in who have had implants in for over 30 years and they're still not broken. I've had patients who need surgery at 5 or 6 years. Unfortunately, some of this probably just has to do with luck. Some of it has to do with any additional revision work that may be needed as you go through the aging process. The body, unfortunately, does age, and so sometimes some aesthetic changes are necessary along the years that might be an opportunity to replace those implants with new ones to reset the clock, even though they're not broken. But in general, there's a curve or a lifespan of an average implant, and the curve starts heading downhill after about 15 years.
Okay. Thank you. Michelle, I'm going to lean over to you next. Our patients get really nervous, and they get anxious about surgery. It's a big deal. I know I was one of them. I had a tough time when I had to go into my reconstruction surgery. Do you have any breathing exercises, techniques, meditation tips?
Yes, and yes, which is why I even created that whole workshop on preparing for surgery. But it includes a lot more than breathing, but here's my go-to breathing technique. It's belly breathing or diaphragmatic breathing. So if you just tune into your inhalation and find the lowest sensation of movement in the torso, it's probably somewhere in the upper belly or lower belly, and you're encouraging that area to expand as you inhale. And then just a long exhalation, either through the mouth or the nose. But it's belly expanding as you inhale. And I've got my hand here on my belly. And so it's either your belly expands up here, or maybe it's a little bit lower. And then just a long, easy exhalation. You want to do that for a minute or two, really just as long as you need to. And really, so many people, we don't give ourselves permission to actually expand our bellies. Like a lot of women really hold the belly in. So giving yourself permission to expand your belly and drop the breath down shifts you into parasympathetic nervous system. Really, that's the calming part of your nervous system. And you really want to be working on that. It's best to practice that before the day of surgery, so it's a little more familiar to your body. And meditation, so many meditation tools, but one sort of perspective shift, that I like to give is present moment awareness. You might notice that your mind is doing a whole lot of jumping jacks, right? When you're anxious and you're going to the hospital, arriving to the hospital. So recognizing that your mind is doing a whole lot of anxious thinking, just label that thinking, and then come to what's here in the present moment. What do you actually see? What's here in the room? What do you actually hear? Is there a scent in the air? What do you feel on your skin? Is there a taste on your tongue? So come to your senses to bring yourself into the present moment. Your breath is always here as well. Internal sensations, just feeling your body sitting on the chair, feel your feet on the floor. Right? So present moment information is your senses. Interrupt those anxious thoughts, that thought loop, and just label it thinking. You might have to do that over and over again, but that's bringing you right here to the present moment and helping you manage those thoughts.
Great. Thank you, Michelle.
Mhm.
Dr. Burgoon, next one up. So can acupuncture help normal sensitivity return to areas after surgery?
Okay, well, I don't think that this has been an area specifically of research. That is the return of normal sensitivity after surgery for breast cancer. But what we do know about acupuncture is that it can stimulate the return of the normal microcirculation in the tissue. And this is true in surgery sites. This is true in terms of old traumatic injuries. And we know that this is one of the ways in which acupuncture is able to help tissue repair. And with tissue repair and restoration is also the best possibility for tissues to for normal function to be restored in all regards.
Great. Thank you. I think there's actually, Dr. Fosno, I felt like that was a question that we had too from our audience is, have there been any studies done on regrowing nerves to feel, get that feeling back in the chest after a mastectomy or reconstruction? Would you like to take that one for me?
Sure. This is one of those topics that I would sort of put in the controversial category. There certainly have been attempts, and we have participated in those attempts to provide reinnervation during autologous or tissue-based reconstruction surgery. For many years, I connected nerves for flap surgery. People have published on this. The published results are, in my opinion, varied. Some studies showing efficacy, some studies showing very limited outcomes. And in my own personal experience, I have found connecting nerves to be somewhat disappointing. There are patients out there in my own practice that I see a year or two out, which is generally what I tell patients to expect, to wait to know whether they're going to get sensation back. But a year or two out, come in and they have incredible sensation. And I go back and I read my op note and I didn't connect a nerve. And I think, well, and I have patients who I did connect nerves and they have sensation. I have patients that I did connect nerves and they have no sensation. And I don't know that there's, in my opinion, a definitive answer to this. So I think the next stage of where this research needs to go is trying to get more granular data and really define if there are certain patients that it may work in and maybe treat those patients only. I think that there's a lot of work that needs to be done here before we can really draw any conclusions. it is certainly the holy grail of breast reconstruction, which is to replace a breast with your own tissue that feels and has sensation like your natural breast. And I don't think we're there yet, but hopefully one day we will be.
Yeah, thank you. I appreciate that. I know I'm going to expand on that a little bit. I know as women, you know, that's such a loss for us, you know, and it is something that we feel like, you know, we know that we have to get that reconstruction done. And, but, you know, you lose that sensation, and I hope it comes sooner than we think, you know, it just is something that is a part of your womanhood, and you end up losing that too. And I talk to a lot of women about it. So I appreciate the work that's getting done there. Michelle, I'm going to move over to you. If you could say, you know, women, you know, they feel like some of those body image or feelings that we have, they feel like they're just not going to feel like me, you know, after reconstruction. I'm just going to feel different. What do I do with that, you know?
Well, certainly acknowledging that grief or whatever emotion is there, just acknowledge it instead of trying to push it away, or the kind of gripping that can happen around that loss of the emotional gripping. Just acknowledge that there's grief here, there's fear, or there's worry. Just acknowledging this fear, and then seeing what else you can bring in, such as gratitude. I mean, gratitude that you live in an age where you can have this surgery and this reconstruction. It's amazing. It's amazing. So gratitude that you've gotten rid of the cancer, hopefully, right? We've taken cancer out of the body, and you have a reconstruction. That's all amazing. So some gratitude, and also it's often a day to day, you know, in this moment, where am I with this? You know, you have foreign objects now in your body, or maybe it's not foreign, maybe it's still part of your body, but in a different place. And so it's like, hey, new friends, what's your relationship now, day to day?
Midnight, stop.
Hello. What is your new relationship to this change? Just like any other kind of big life change, you know, where are you today with this new life change? It's a moment to moment, day by day relationship to something that has changed. So breathing with it, seeing what's really here, doing different tools to help you process what all is here, meditation. I like writing, so I encourage some people to write, but it's really like allowing yourself the time to be with what's all here on all of these levels. It's so many levels, instead of kind of shoving it away and moving on with your busyness, right? Busyness does have a place, but if you really want to work on a holistic healing process, you'll give yourself the space to be with everything that's here.
Yeah, thanks, Michelle. So I'm trying to be mindful of time, and we also have so many questions in the chat. And Dr. Fosno, I did want to try and get to some of them. So if you don't mind, I'm gonna put a couple your way right now. One was, I had a lumpectomy and a partial mastectomy on the left, leaving me with an inverted nipple. Is there any non-surgical process that can return the nipple to a non-inverted state? That's the first part of her question. Secondly, after my reduction, I had decreased sensation in the nipple area. Am I understanding correctly that sensitivity may return?
Both good questions. So nipple inversion is a common problem. There are procedures that can be done in the office to try to get better nipple projection. It really depends on what the deformity is like. So it's a little bit difficult to speak specifically to this person, but there may be some less invasive options in the office that you could certainly try. As for sensation, I generally counsel patients that the vast majority of nerve regrowth occurs in the first year, but there still may be some improvement over the second year after surgery. After about 2 years, I usually counsel patients that the return will likely not yield any more sensation and or be incredibly limited.
Okay. I'm going to give you one more here. So how does a doctor decide between a tram flap and a deep flap? We had quite a few questions on deep flap in here. But...
So good question. A little bit depends on nomenclature and what this person's referring to. So there's an original tram flap that was something that plastic surgeons did decades ago, which usually required taking the entire muscle off of the abdomen and sort of what's called pedicling it, meaning not disconnecting the tissue and moving the entire tissue up to the chest by cutting the entire rectus muscle. If that's what this person is referring to, we generally don't really do that operation anymore. The vast majority of approaches at this point are either with a DIEP flap, a muscle-sparing free tram flap, or an SIEA flap, which are all derivations of the same piece of tissue from the lower abdomen. And it really depends on your anatomy that is encountered in the operating room on the day of surgery. So I think most of us set out to do a DIEP flap in every patient undergoing an abdominal operation. Sometimes we end up doing an SIEA because that's actually less invasive than a DIEP flap, but most people do not have the blood vessels to be able to do that operation. Sometimes we have to do what's called a muscle sparing free tram flap. That means that if this is your rectus muscle, we're taking a very small piece of it, maybe like this amount of muscle out of the central core of the rectus muscle. That means the vast majority of the muscle is still left where it should be, but for safety reasons, a small cuff of muscle is taken with the flap and moved up to the chest to make sure that those blood vessels are not cut or injured. That also is largely dependent upon what your blood vessels look like in the operating room. So the short answer to your question is the decision is usually made on the table based upon your anatomy, based upon safety factors and what we think is best for you.
Great, thank you. So I'm watching our time and we have so many questions here. So Amy, I know we can download this chat and we will actually present these questions to our panelists. And then we'll give you guys a link so that you can get all of your questions answered. I feel like that's the best way that we can just ensure that, you're getting what you need, and then you'll be able to get right to that link. We'll put it on our Ask the Experts page at Unite for Her, or Amy, if you have another page, we can link there as well. But that way we'll just be able to, just close out the evening on time and have another access to getting these questions answered. So thank you all. That was a great discussion. I think you guys could be here a long time if we were going to get through that chat. So informative. We appreciate it. We appreciate your honest approach as well. Yeah, it was a great day. I am going to close it out for all of you. And again, thank you to our panelists for having a great conversation with our participants this evening.
Thanks for having us.
Thank you, Sue. Thank you, Amy and Nina and Sue. This was great being part of this. Thank you for all your work putting it together.
Yes, thank you so much. It's been great being here with you all.
You're welcome.
Thank you, everyone.
You're welcome. So that is the end of our day. I think that it went so quick. I don't know about you guys, but I hope you enjoyed it. I do feel like you can feel, the energy resonate through the screen. And I hope you felt that today for us to have this type of event virtually. And we're so honored to be able to partner over and over again with Penn Medicine. And this is my first Penbra Day. So I look forward to attending those in the future. And I will look forward to it being in person. Dr. Cerletti, do you have any last closing remarks you'd like to give?
Sure, very brief. Sue and Nina, thank you so much for doing what you did. This was just incredible. And, given the limitations of the virtual thing, this was spot on, absolutely spot on. And, I don't know if Amy already knows what the date is for next year, but let's all plan to get together in person next year. We actually had planned this in person this year to be at the College of Physicians of Philadelphia, and our hope is to do that obviously next year. So just another wonderful event. It obviously a lot of what I do is take care of breast cancer patients, and when we do something like this, it just reinforces the importance of what we all do in terms of getting people through this journey. So thank you all. I'm sitting at my desk and I look out at the skyline of Philadelphia. And if you want to see something pretty special, all of you should go outside and look at the moon. There is a full harvest moon that is incredible. And I think that that's telling us something. I think that this is telling us this was a great event, and this is a way of somebody telling us keep on going. So
Yeah, I love it.
Thank you.
Great.
I'm waiting for that. Well, that's a wrap. That was a nice way to end. And you know, when we do these events, we always try and get all the senses in. You know, we want you to feel it. We want you to have something tangible. That's why we give you the gift box, you know, and just to make them a little bit more in-person feel. And I think this did it. So we appreciate everybody that spoke this evening. Incredible to be here. And yeah, let's go look at the moon. Thank you all.
and see you next year.
We'll see you next
Good night,
year.
everyone.
Good night. Take care.
Your doctor.
Thank you. Thank you.
Good night, everyone.
Thank you.
Thank you.
Good night.